Hello friends, today we are going to learn about gemination. So we're going to see what is gemination in detail. So what is gemination? Gemination is nothing but when single tooth germ invaginates, resulting in incomplete formation of two tooth that may appear as bifid crown on a single root. It will appear somewhat like this. The crown will be two, but the root will be one. So when gemination is usually occur, it occurs usually during the proliferation stage of growth cycle of tooth. So here the proliferation stage is very important to remember. And gemination also has hereditary and familial tendency. So it is usually runs in families and it has a hereditary tendency. Now next moving forward to what are the clinical features of gemination. So the most affected teeth are deciduous mandibular incisors and permanent maxillary incisors. So it appears as biped crown on single root. So here the two bifid crown will be there on a single root. So while using the tooth numbering system, we are count this geminated tooth as a single tooth. So the number of teeth remains the same. There are common pulp canal and either single or partially divided pulp chamber is seen. So the pulp canal inside will be common, but the pulp chamber will be divided. So the tooth will somewhat look like this. We are going to see how it going to look on clinical basis. So this is a self-explanatory picture. You can see this central incisor is geminated tooth. The crown has divided into two portions, but it will going to have common root which is embedded into the bone. So we cannot see on clinical side, but we can easily appreciate single root and two bifid crowns on radiograph. Now let us see radiographic features in detail. The radiographic feature is cleft crown. We are going to see the cleft in the crown. The cleft in the crown and invaginations are usually outlined by the radiopaque enamel which is accentuated them. So we can easily see invagination in the crown which divides the crown into two portions which give them geminated appearance. When we're talking about the pulp chamber is single but enlarged and may be partially divided. This is a beautiful picture. Here you can appreciate the crown has invaginated into the tooth which divide them into two tooth, and also you can appreciate the pulp chamber is also divided into two parts, but the tooth is single, so the radicular pulp is single. Now next moving forward to diagnosis, how we can diagnose this situation during our clinical practice. We're going to see on a clinical appearance that crown is bifid and having a single root, and pulp chamber is single and enlarged. So these are the features we usually appreciate, and this is how we can diagnose gemination easily. Let us see management in detail, how we're going to manage this condition called as gemination. So what we're going to do for management of gemination, the crown may be restored and reshaped. We can reshape according to anatomy so that it can give proper aesthetic. Periodic disking, that is nothing but reduction of mesiodistal width. So what we're going to do, we will going to reduce this mesiodistal width, and after that we're going to do crown preparation, and after that we're going to take a measurement and we're going to provide the patient a new crown. So it will going to be look somewhat like this, a single tooth. After mesiodistal width reduction, after crown preparation, and after cap or the artificial crown placement, so it will going to provide aesthetic to the patient, and that would be only our aim, to correct the aesthetic. So here we have come to an end of this topic. Thank you.